Alrighty, and so we should be live now. Hi everyone, welcome to another Dental Shadowers virtual shadowing session. Today we are joined by Ms. Deidra Russell, who is a dental hygienist, and she will be talking to us about dental hygiene today. So Ms. Deidra, whenever you're ready, you can take it away.
Yes, hello everyone. Thank you, Dental Shadowers, for having me on your page. Thank you for reaching out to me, and I'm just so excited to, inform you all about the career of wonderful dental hygiene. So let's get started. So I'm going to start off with a little introduction. So as you all know, my name is Deidra Russell. I was born and raised in Miami, Florida. So shout out to any Miamians who are out there. I am a Bahamian American. My whole family is from the beautiful islands of the Bahamas. You can see the Bahamas flag waving right there in the corner. And my favorite pet is a dog. And my favorite hobbies are swimming. It doesn't matter whether it be the beach or the pool. I love bike riding. It's so therapeutic for me. And my favorite sport is gymnastics. And of course, I love shopping. You can never have enough clothes or shoes. I love eating fettuccine alfredo from Olive Garden is the best way to go. And of course, I love sleeping, especially after hard days at work. All right, let's get started. My journey to becoming a dental hygienist. As you can see, we have the little roller coaster right here. When you get into the process of becoming a dental hygienist, literally it is nothing but ups and downs. It is not easy at all. Like if there is someone out there who went through dental hygiene school and had a straight and narrow path and didn't have any negative hiccups, I would just like to know who you are. Please let me know. But from what I've been through and what I've gone through with some of my classmates, it is a tough journey, but for sure it is very achievable and attainable once you put your mind to it. And it's such a great reward. I love how I flourished at the end and how I've seen my other classmates flourish through, dental hygiene school and becoming dental hygienists. And it's a wonderful career that you can be passionate about. And so the next slide, I'm going to show you where it all began. All right. So as we discuss and continue the journey of becoming a dental hygienist, I'm going to share what sparked that drive. So it all started when I was in undergrad. I went to Oakwood University and I studied biology. And I had the idea of, yes, I would love to have a career in dentistry. So I was going back and forth between becoming a dentist or becoming a dental hygienist. And then in my junior year, I, made an appointment to go to the dentist, to have a regular checkup, to see if I had any cavities and to get my cleaning. And so when my hygienist was done, cleaning my teeth, I felt very good on how I felt just talking with her, communicating with her. And I just loved how my cleaning felt. Don't get me wrong, I'm sure, being a dentist is such a wonderful career as well. I'm sure there's wonderful, fabulous dentists who are out there, but I just really had this feeling. I had this calling where, yes, I must become a dental hygienist. I loved how, she gave me all the education about having good oral hygiene. I love the good patient care. I love the fact that you get to have your own room in a big dental office and just the fact that you get to work, by the side of a dentist. And, you guys collaborate with one another to come with ideas on how to treatment plan for a patient. I just love all of it. I love how in dental hygiene, you get to have multiple hats. You get to be a massage therapist where you palpate, the neck and the face to, see if there's any abnormal lumps. It's just a wonderful career and it's not just all about cleaning. All right. So down to the very beginning of my journey, I actually got rejected the first time that I applied to dental hygiene. So what happened was that I had all the classes that I have taken from undergrad, with my bachelor's in biological science degree. And so when I saw the prerequisites that entailed, to get accepted into dental hygiene, I saw that there were 3 courses that I did not take. It was, both the parts of anatomy and physiology 1 and 2. And then I had sociology that I didn't take, that I saw that was part of the prerequisite list. And so I still applied. I was like, they should accept me anyway. I mean, I have a bachelor's degree. This is an associate's program. I should still have the upper hand somewhere. But lo and behold, a couple months later, I get this beautiful rejection letter. As you can see, I underlined the infamous words that showed that I did not get accepted into the program. And so when I saw that letter, I wasn't really like sad. I was like in the middle of, I guess you can say I was disappointed. And I was like, wow, like I really didn't get accepted. I thought, since I had a bachelor's degree, I would get in. But obviously, it's a ranking, and they're going to choose those that obviously have all the prerequisites done. They're going to do the best. It's like a ranking. They're going to choose those that have all A's, and then like down to rank 10, it'll be those that have A's and B's. And then maybe down to the last person, they probably have 1 C. And then on my end, I didn't have anatomy, physiology, or sociology completed. And so then I thought, should I just give up and then go to a different profession, just do something else? Because I was tired of the waiting game. It's so frustrating sometimes, like how when you apply to a program, you have to wait a whole year. And then you just feel like your life is just passing you by. But I told myself, I really want to do this. I really want to become a dental hygienist. So in that moment, when I saw that rejection letter, I was like, okay, I'm going to do this. I'm going to take the 3 courses that I am missing. I'm just going to get it out the way and just put in the back of my mind that no matter how long it takes, I'm going to be a dental hygienist. No matter how much older I get, I am going to be a dental hygienist. So I did it. So in that summer, when I got the rejection letter, I took up anatomy, physiology 1 and 2, and then I did introduction to sociology. I started in August, and sociology was the last course that I have completed. And then as you see, I made sure that I had all A's in those classes so it could be solidified that I do get accepted into the program. I didn't want to have any ifs or buts. I really wanted confirmation for myself that yes, I'm going to get accepted into this dental hygiene program. And mind you, I put all my fruits in one basket, literally. I only applied to Miami-Dade College. I just applied to one school in Florida, in Miami, because it was very convenient for me. I wasn't, it was very close to home. And then also I can work a little part-time job here and there. And, I'm still with my family. So I really wanted to be accepted into Miami-Dade College at the medical campus. Okay. And then, yes, as you can see, I got accepted into Miami-Dade College Medical Center Campus Dental Hygiene Program. When I got this letter, I screamed to the top of my lungs in my house. My dog got scared. He started barking. My sister and my mom, they thought something terrible happened. I was just screaming. I was over elated. This is one of the most successful moments in my life. Just the fact that I got an acceptance letter into a dental hygiene program of my top preference. And so the journey begins. So in this slide, it basically shows just the journey, like the academic life of me being in the dental hygiene program at Miami-Dade College. So this first picture right here, this is where we got situated into our operatories in our clinic. And, we got all the supplies that we needed from Patterson Dental. We just purchased all of our cassettes, we got our loops, we have our little typodont there, and we have our clipboard and all the other supplies that we needed for the dental hygiene clinic courses. And so in the second slide, in the second picture, this is my buddy Anna. We actually did a research poster on Crohn's disease and how it affects your oral health. And so it was a clinic poster that you would present to our classmates, and we would also present to our instructors and our professors. And I really enjoyed this topic of Crohn's disease because, man, they really go through a lot. And I really hope that they are able to maintain their oral health, because this, condition, it could be very brutal. And so me and Anna, we really enjoyed, just learning a lot of information on Crohn's disease. And we really wanted to bring awareness to others that had no idea about Crohn's disease. And then in the third picture that you can see, this is me actually learning how to use an ultrasonic. And so this one is specifically the magnetostrictive. And we were learning how to adjust the water. And then we also practiced on a typodont, because there is a specific way on how you're supposed to hold this instrument here. And then in the fourth picture on the top, that is me learning how to administer local anesthesia. That was an interesting day, because that was a day that we would have to actually inject one another. We had to actually numb each other, feel the little pinching sensation. And the numbness didn't wear off until I got home. It was quite annoying, but it was very fun. And we really enjoyed like how we did a milestone, just knowing that we actually got to, inject a very sensitive, sharp object into someone's gums, but it was very exciting. And so in the first picture on the bottom in the second row, I was actually the mannequin, the test dummy. That's one of the instructors. He's showing like how to properly administer anesthesia in a specific area in the mouth. No other student wanted to do it. So I said, you know what, let me just do it. Let me be the test dummy, so I can at least have an idea on what it feels like. So when I inject anesthesia into a patient, I can at least guide them and give an idea how it's going to feel, because I went through it and how I had an idea on how it felt. And then on the second picture on the second row is where during that clinic day, I was clinic monitor. And I would, assist other classmates on the whatever procedure they had to do for that day, whatever treatment they had planned for the day on their patient. And I would just float around to other clinics as well to see if anyone else needed help. And it was very fun. I got to see like different treatments that they would, do on their patients, and how every, clinician is different. Every dental hygienist is different. And I really enjoyed like engaging with them. And they also gave me pointers on, how to do certain things with patients. And then on the third picture in the second row, that is also where we're learning how to do anesthesia, where before you administer anesthesia, you have to actually put a little numbing gel first. So when you inject the needle, it wouldn't feel too painful. You're putting a numbing gel while you're numbing, so you can ease the tension a bit. All right. And then in the fourth picture, in the second row, I'm actually practicing how to apply sealants on a tooth. And for those that don't know what sealants are basically you put a little composite on the tooth for anyone that has deep grooves and fissures on the molars of their teeth. Because if you have deep grooves and fissures, you're prone to getting cavities. But sealants, it does exactly what it says. It seals the tooth and it prevents, the bacteria from the saliva to seep down into the grooves and fissures. And that way you wouldn't develop any type of cavities. And it can also prevent staining as well. And then the last picture on the bottom, that's where we had to do an assignment where one of our professors for extra credit, They told us to do like little posters, that are motivational for the patients to see around the clinic. So I decided to do one. And so it says, don't want tooth loss, floss, floss, floss. And that can bring motivation to others to floss more so they wouldn't progress with periodontal disease or have any type of gingivitis. Right now, we're going to move forward into the journey of becoming a dental hygienist. So I believe in community service. I love it so much. I love giving back. I love serving others. And so this first picture is where I went to Orlando for Special Needs Olympics. It was at the ESPN Wide World of Sports area. And so it was such a wonderful experience just working with the special needs. And you watch those who, do weightlifting, those who do basketball, baseball, even gymnastics. It was so amazing to see all the special needs patients just having fun, and then also educating them and guiding them to have proper oral care. And then in the second picture on the top is where I went to a classroom. These are second graders, and we educated them on having good oral hygiene. Obviously, we always tell them to, not consume a lot of sugar, don't eat a lot of cavity, drink a lot of soda, always brush your teeth morning and night, and, drink more water. And it's so fun. Honestly, I enjoy teaching kids than adults because they're so excited, they're so happy, they're willing to learn. Take me to a classroom any day. I love it. And then the third picture right here is where I actually, with some other students at the Miami-Dade College, like they were PA students and medical assistants, where we did a march and protested for those that are being human trafficked. It's a very special topic that is being, spoken about a lot. There are a lot of continuing education courses that are offering credit for human trafficking. And, when it comes to this sensitive topic, it's always important that we try and spot out and, identify patients that are possibly endangered by someone, in a specific location, and just, providing help. And, if they need help, there's, phone numbers that you can reach out to, and going on websites just, to help and assist others that, don't necessarily have a voice. We have to be a voice for them. And so what we did was we actually marched around the block of our campus, and we would chant out, "Stop human trafficking, stop human trafficking. It isn't right, it isn't right." So I really enjoyed protesting with Anna and, some of the the physician assistant students, and, the president of the campus and the instructors and other professors. And then on the first picture on the second row, that is also at the Special Olympics. It's actually like in the Disney World Resort, as you can see. And that was the booth that I was at, with my friend Tamar and Heather. At that booth, that's where you see that we would provide oral hygiene instructions. We would show them how to properly use a toothbrush on the puppets that have the teeth. And then we would also play, certain games with them. We would give out little worksheet paper exercises just to allow them to understand and comprehend the idea of good dental hygiene care for themselves. And then in the second picture on the second row, I'm actually volunteering at a Colgate van. As you can see, it's also with kids. With the Colgate van, they can make appearances at schools. All you have to do is just email them. And then there's a big bus that shows up in front of the school. And for any hygienist or dentist that want to volunteer, you just go on the bus and you provide oral hygiene care and instructions to the students. And I really loved it because they're very attentive. And then while you're doing the education portion, in another section of the bus, someone can be doing screenings where they show like what type of risk they're at for having cavities and how often they should go visit their dentist, like how soon they should go to the dentist, because there have been kids that have severe cavities disease, caries disease. And, you can check off on a box saying that they have to go see their dentist as soon as possible. So it's always enjoyable, that you can change, a child's life. and save their life as well, because there's kids that have, ramping caries, and sometimes they may have to have their teeth extracted, because they don't have any knowledge on good dental care. And then the picture next to that, the Colgate bus, is the Colgate van again. I took a picture because next to the bunny, as you can see, there's bunny ears. I kind of cropped it out, but it's okay. Their theme is, or their main cartoon character is a bunny rabbit, and he has other friends. Obviously they're like superheroes, and their main goal is to fight, bad oral hygiene. They want you to like not eat a lot of sugar, drink a lot of water, brush your teeth, and go see your dentist regularly. And then the last picture all the way on the right, that's where Miami-Dade County, they have a book fair. And it is at a big Miami-Dade College campus, and they have tents everywhere where you can buy all sorts of books. And then in the kids section, where you can always find me, they have the kids section where also you perform and give a lot of information on oral hygiene instruction. And then you provide stickers, you give out toothpaste that has fluoride in it, and you can also give out toothbrushes to them as well. So as you can see, I am all for community service, and I cannot wait until, the pandemic, goes down a bit so I can go out and serve the community some more. And then alongside with community service, I also believe in leadership. When I was in the dental hygiene program, I was president of my class, both freshman and my senior year. I'm very active. I love, speaking for my class. I love being the voice. Any type of concerns or problems that was happening, they always came to me. And then I would always address it to the professors. I love being the voice for them. And I love also orchestrating activities for them. And for also the whole dental hygiene program, when you put it on for the freshmen as well. And then the pictures on the left and right, that is actually where I participated at a dental hygiene symposium that's always held in Orlando, Florida. I was actually the vice president for the Florida Student American Dental Hygiene Association. And there was a specific day where basically all the dental hygiene students in the state of Florida, we all come together, and then we have speakers come in and just, give us good motivational talks and how to progress further and how to be great hygienists. And I've also done, activities with them where we would do chants with one another, and we did raffles together. It's such a wonderful experience. And for anyone that's across the nation, I really encourage you to take action and participate in any type of, dental hygiene association that's in your state. Get active, be involved, put your voice out there and just mingle with one another. And so coming down to the very end, here are my accomplishments where I graduated from the program after 2 long years. When I first started the program, I was like, oh my goodness, 2 years sounds like a very long time. And then now look, I started in 2018. Now we're in 2021, almost 3 years has passed. And so here is the email that the director of the program, she emailed to us, because as you can see, I was the pandemic graduating class of 2020. In March, that's when it all started. And, we had to evacuate the premises immediately. Like we had an emergency evacuation in March. And so obviously in April and May, we had to continue with our studies over Zoom or Blackboard. And obviously they had to waive some of the clinical stuff that we had to complete in order to graduate. And so we had to do our finals online. And, it's still a little bit disappointing sometimes because we never got to have our graduation ceremony. We never got to have our pinning ceremony. Some of us still feel empty inside, but obviously you have to just keep moving forward. So what me and some of my classmates did was, as you can see at the bottom, we all got together since nothing was, put on for us to, to send us off the right way. We just met up at a restaurant that was outside for circulation, and we met up for brunch. And then we just took pictures together. Someone made beautiful frames as if you're on an Instagram. They made a template saying, "Congratulations, we did it. We graduated dental hygiene class of 2020," just so we can feel special, just to commend ourselves, just to know that we actually succeeded and completed the hard studies of dental hygiene. And I miss my class dearly. They're all doing well. They're great. And hopefully somewhere down the line when things get better, we can meet up again and just, go over memories with one another. And then as you can see on the right, here is my lovely dental hygiene diploma. It felt great to have this in my hands. I felt very worthy. This was hard work and I deserved it, and so did my classmates deserve it. So even though we didn't have any type of ceremony, just having the diploma was a ceremony for me. All right. And so as the dental hygiene journey continues, the boards. As a dental hygienist, you have to take 4 board exams. 3 are written and 1 is a clinical portion. So the first exam that I took was the laws exam. It's basically like the laws to practice as a hygienist in Florida. So you have to learn what you have to do as a hygienist, what you can't do, and what you could do when the dentist is around, when he's not around, or when he's on the premise, but not exactly, in your room. And so the next exam that I took was one of the hardest dental hygiene board exams, and it's the nationals. And so it took me 3 months to study for that exam. Like after we had to go into quarantine, I started studying around March, maybe even April. And then I took the exam in June. And then this exam, it's so nerve-wracking because if I could remember, it's 300 questions in total. And then after you take those 300 questions, you actually have to wait 2 whole weeks just to get your results. So you're just stressing. And then I'm just in the house during the quarantine, just like, oh my goodness, when is the results coming in? And every day I would just log on just to see if I got the results, knowing that the results wouldn't be there. And then the night before, I'm just in my bed, I'm distracted. I'm watching a movie. Then I get a text message from a friend because me and her, we took the exam the same day. Then she just, texts me saying that the results are in. And then my heart just dropped to my foot. I'm like, oh my goodness, the results are here. I don't want to look. I didn't want to look. I think I put my phone like under my pillow. I'm like, oh my goodness, the results are in. But obviously, eventually I looked and then I passed. And then I had another screaming moment where I scared my dog. I scared my sister. My sister was just wondering what was going on. I think I woke my mom out of her sleep because I saw the results either at 1 or 2 a.m. And so I just screamed. I feel like maybe the neighbors even heard. But this is another accomplishment that goes down in history for me. And then after the nationals, I took another exam that's basically a written version of the clinical portion, or you can say it's basically a condensed version of the national exam. And I took it literally a week after I took my national exam. And mind you, I was already stressed, but I was so burnt out. I was like, you know what? Let me just get the exam out of the way. I'm tired of studying, for studying for the nationals. I'm sure I already have the information for studying for the computer stimulated clinical exam. So I just took it and then boom, I got the results that same day. I was like, whew, thank you. After every written exam, I got a headache. And then one of my classmates actually told me that anytime you get a headache, that means you passed the exam. So, fun fact for those that are going to be in the process of studying for your boards and taking your boards, if you got a headache after your exam, you most likely passed. And she told me this like 2 weeks ago. I was like, wow, what a coincidence. And then the last exam that I took was the patient treatment clinical examination. Originally, you're supposed to do this exam. This is where you actually clean the patient. And so, due to the pandemic, we actually did our exam on a mannequin. And I was actually grateful for that because when you have to do this patient treatment clinical exam on a live patient, when you choose your patient, you have to make sure that they actually qualify for the exam. You just can't get any random patient. There's actually guidelines that you have to actually follow. Like there's a certain way that their calculus has to be. And, I can truly say that that's probably one thing that I could probably benefit from, the pandemic, because I didn't know where I was going to get my live patient from. So for them to say, hey, you guys are going to do this on a mannequin, I was very happy. And so that was the last exam that I took. And I believed I finished in the month of July. And then I got the results the next day. And that wrapped up my journey of studying for hygiene. My academic career was finally over. And as you can see in the middle, I posted that I passed an NBDHE. It is such a relief. And then I'm also like happy for those that, the people that host the board exams, they actually were very kind enough to create a short version of the national board exam. Like they cut it from 300 questions to 150. So that was another stressful moment where should I take the 300 question exam or should I take the 150 question exam? Because if you take the 300 question exam, you have a higher chance of passing. But if you take the 150 question exam, you probably don't have a higher chance of passing. But I took the 300 question one, I passed, and I think they're still allowing others to take the 150 question exam. And so after I passed all my board exams, I applied to get my license. And that's when I started looking for jobs. Literally a week after I got hired at the dental office that I am at right now. It is truly a blessing. And I find it so convenient because the office that I work at, it's only 20 minutes away from my home. I love my coworkers and I'm gaining a lot of experience. And I just feel like the office that I'm at right now, this is where I'm supposed to be. It could be strenuous at times. It could be very stressful, but I enjoy it. I really have passion for it. All my patients can see how passionate I am about talking about dental hygiene, getting their oral care on track. I am so excited about this profession and I will really retire into this profession. And so, as I, apply for jobs, I went on Dental Post. So for those who are, becoming a dentist or a dental hygienist, there is an app called Dental Post. And so you create your profile on there. And then basically, they have a list of offices that are looking for dental hygienists or dentists. And then the best part is they end up reaching out to you if you match their guidelines and their standards. And so actually the job that I'm at now, it wasn't even because of Dental Post, but I did end up getting like 3 job offers, but they just didn't work out. It just wasn't the office that I was looking for. And so then how I was able to get, the job at the office that I was at now was there was another student who also attended the same dental hygiene program as me. Shout out to Alejandra. She reached out to me and she said, "Are you still looking for work?" And I said, yes, I am. And then she said, there's this lead hygienist that's looking for someone. And so I just gave her my number so she can give her my number. And then she ended up reaching out to me. And then she gave me the working interview and also the interview as well. And then I just ended up getting hired. And so the rest is history. So I really love where I work. It really brings in the passion. I'm always excited to go to work. It could be, a little hard to wake up early in the mornings, but once I get to the office, I am just ready to go. I get to see the patients, the new patients. It's all a fun learning experience for me. And so, yes, this picture right here was the day that I was officially hired and started working as a dental hygienist. All right. So, advice for college. So for anyone that is interested into getting into a dental hygiene program, one of the advices that I would love to give you is pray. For anyone that just believes in prayer, I prayed all the time. I prayed every single day. I would just pray through anything. When I was like, trying to do x-rays on a patient, and if the sensor was very big, I'd be like, please just please help me to get the right angle. I would just pray through everything. So for anyone that believes in prayer, just pray. That's just how I made it through dental hygiene school. And so if not, always have support from your family. You cannot go through this program alone. You need that extra support from your family. You need them to pick you up when you are very down. You need them to give you motivational talks. It is very important. And, they need to have an understanding that you're not going to be around them as much because you're going to be studying every single day. You're going to be stressed out. They need to understand that you're going to be emotional through this journey. And then not only should you have support from your family, you need to have support from your classmates. I never went alone through this program. I was always in a study group. I always went to my friend Anna's house and we would study. Sometimes we would do all-nighters anytime a midterm, a test, or quiz was coming up. I always went to her house. And you can always make study sessions fun. She would always cook for me. We would always have dance sessions, watch a little movie or show here and there. Make the study sessions productive, but you need to have fun at the same time. Dental hygiene, it's a very tedious, rigorous program, but you got to make it fun. You got to add some funness and happiness to it just to make it through. And so that's where staying positive comes in. You have to be positive. You can't go in with a negative attitude. You shouldn't be sad. I mean, there's going to be moments where you're going to be sad, where you're going to be upset. You're going to have a lot of downtime, but you must brush your shoulders off, get back up, be sad or angry maybe for like 2 minutes, but brush it off. Keep moving forward. You can do this. You have to tell yourself this. You can do this. Give yourself pep talks. All right. And then the next tip I would give is be organized. You cannot go through this program with clutter everywhere. You cannot, procrastinate. You cannot study the last minute because the information is very intense and they give a lot of information. This stuff has to be looked at every single day until it's time to take the quiz, the test, final midterm, anything. You have to be organized. I may not have been organized like some of my classmates that had, their full on agenda. They walk with that book everywhere. It's not me. I make little mental notes here and there, and then I jot down on my phone. But be organized the best way you can be organized. And then the next advice I would give is take breaks. Breaks are needed. There was a moment when I was just so burnt out that I just I didn't feel like studying. I didn't, the stress was just so real. So what I did was I just watched music videos for the rest of the night. I had snacks. I looked up tutorials of my favorite topics on YouTube. Always take breaks. Do not run yourself to the ground, please. It's always nice to take a break, and you are allowed to take a break. It's never, it's never bad to take a break. Take your breaks, take your breaks, take your breaks. Even if there's a day out of the week that you don't study, do it. Go for it. All right. And the last one, never give up. In the beginning, when you start dental hygiene school, you may feel like, oh my goodness, this is going to take forever. How am I going to do this? How am I going to make it from this point to this point? How am I going to find my patients? How am I going to study for all of this? Why do we have quizzes every single week? Well, just don't give up. Keep on pushing forward. You will never know until you find out. All right? If you fail a test or a quiz, brush it off. Keep moving on. It's going to happen. I'm not going to lie. I won't sugarcoat. I have failed quizzes. I have failed tests. But the best way to make up for it is to keep on moving forward. Knowing you can do it, you can always make up for it in the other quizzes and tests that are coming. And just know that you're going to pass your board exams. Okay? Just keep that in your mind. Keep pushing forward. Never give up. All right. So as we get into, the career of dental hygiene, I'm going to explain what dental hygiene is. So let me move this out the way here. So dental hygiene is basically where you have the dental professional, the dental hygienist, and they work with the dentist and they collaborate and they come up with treatment plans and they provide preventive oral care by cleaning the patients, and then you examine their gums for any signs of infection, if they have, any damage or diseases. And we also teach the patients about having good oral hygiene. So we prevent, we maintain, and we treat just to have good oral health. Okay. All right. So I am going to explain what a typical day is like in my work life. So when I first get into the office, I always set up my room. We have infection control and we have specific wipes that we use that are bactericidal. They clear off all the bacteria. They clear off, viruses. Everyone would know them as cavi wipes. So I would wipe down my chair, the counter, and other objects that I would have to touch while I touch a patient's mouth and I have my gloves on and I have to touch that object. I wipe that down. And so I set up everything. I put my instruments together. I set up my tray. And then after I set up my room, I have to review the patients for that day. Typically a hygienist can see 6 to 7 patients, maybe even 8. Hey, there are even some practices that can see maybe even 10 to 11. It all depends. All dental offices are different. So I would review the patients for the day. And so the software that I use is called Dentrix. And so I would look up all the patients and I would see when's the last time they've had a cleaning, what type of cleaning that they had. Did they just have a prophylaxis? Did they just have a periodontal maintenance? Did they have a deep cleaning? So I would also look up, what products were given to them and why the product was given to them to get them on track to good oral care. And then obviously throughout the day, clean, 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 clean. I clean the patient's mouth. And then obviously there's going to be a lunch break. We have a 1-hour lunch break and boy, it is needed. All right. I recommend take your lunch breaks, whether it be 5, 10, 15, 20, take your lunch break. It's always good to replenish yourself with water, with a snack, anything. Just take the lunch break. And if there is a dental office that doesn't offer a lunch break, that is not the one for you. Don't go there. All right. And so, also throughout the day, as I'm juggling cleaning my patients, I also examine new patients. You know, there are always going to be new patients that come into the office to see if they want to make the dental office that I work at their home. So sometimes during my cleanings with the regular patients that come in, sometimes I have to stop the treatment and go seek out the new patient and see what they're in for. And then I'll also provide, my recommendations for them on how they should maintain their oral care or how I can treat the issue that's going on with them in that moment. And then also when I'm done, cleaning my patient, I'll recommend products to them. I'll recommend treatment. Like there'll be some patients where they'll have, the silver amalgam fillings that were done in the past and still could be done now. But, they end up wearing out throughout the year. So sometimes, after approved by the dentist, I'll recommend, the composite fillings. Or I could recommend night guards for those that are grinding and end up having attrition, where their teeth are worn down. Or I can also recommend ortho, orthodontists where they can wear braces, whether it be traditional braces, fast braces, or Invisalign. And then I have a duty where I have to send letters to patients where we thank them for coming in. Thank you for being a part of our family. And we can also ask them if there's anyone that they would like to bring to the office. We do have a referral program. We always love, our patients to recommend because we want all our patients to be just like our other previous patients. So I always do 3 to 4 letters to a patient that I had for the day and also to other future patients that I might see, in the months that are to come. And then also I write notes. Always write your notes on what you have done on your patient. That is a legal matter. I always write, the procedure that I have done on my patient, whether it be like prophylaxis, whether it's a deep cleaning. Did I administer antibiotics to the patient? Did I provide sealants? Did I give, a fluoride tray? Always jot down what was done in that appointment with that patient. How did their gums look? Did it look, inflamed? Were they swollen or did they look very healthy? Did they have any pockets? Always write down what you see and always write down the chief complaint of the patient. And then when the doctor ends up coming in to do his doctor's exam, write down what the doctor also treatment plan or stated towards the patient. Writing notes is very important. And then towards the end, I have my closing duties. I would break down everything, I would clean up, and then I would set up my operatory for the next day. Like right now, my chair is already set up for the next patient that's coming in at 9 a.m., just so I can cut down on time and, I can make room for mistakes. And then I have to make sure like my chair is working, the instruments that are working, like if I have to use like one of the ultrasonic pieces, I have to make sure that it's working, the water is running, the machines are running. I just make sure that everything is put into place. And then I'll also print out like the treatment plans, like the treatments that I've done on each patient. And I print it out and I give it to the people who work in the front. And then I just clock out. Then I go home just to do it all over again. So that's a typical day, part of it, some of it. So the type of dental office that I work at is a multi-specialty practice. So we have general dentistry, there's periodontics, there's endodontics, and there's oral and maxillofacial surgery. So obviously with general dentistry, we all know that it deals with where you have your primary care dentist and you deal with cosmetic dentistry as well. And then you have where you could recommend fillings, You could recommend where the patient may need a crown or a bridge. You could recommend, amalgam filling replacements. There's just so much. You can recommend veneers. And then if a patient needs a root canal, that's where we have them go to the endodontist, who's also in our office. And so the endodontist, that's where they deal with the pulp and the tissues of the tooth. And so I put 2 asterisks on general dentistry and periodontics because that is where I put emphasis more on practicing as a dental hygienist. When it comes to oral and maxillofacial surgery, that's where we have patients and we can recommend them if they need an implant or if they need to have their third molars or the wisdom tooth extracted. So we have an oral surgeon who comes into the office. And so whichever patient we recommended that treatment, they just go to the oral surgeon and she just handles her business and they just go from there. And so I'm going to discuss a little bit more on me working in general dentistry and periodontics. So in general dentistry, like I said earlier, that's where you have your primary dental care provider. And they have, their responsibilities where they make diagnosis on, if you need fillings. They can also recommend, periodontal care, the root canal surgeries, there's crowns, there's bridges, and then they also can do the preventive education. And so with periodontists, they are the specialists where they examine and they treat gingivitis, where it's the inflammation of the gums, and periodontitis, where it's gum and bone disease. Basically, the gum and the bone, it's combined and there's just inflammation going on. All right. So me as a hygienist working in periodontics, when I have a patient that is dealing with periodontal disease or maybe even gingivitis, I always first do probe measurements. As you can see, the animation on the bottom, you use a probe. It's a diagnostic tool. So what it does is it's like a ruler and you measure 6 areas on the tooth. You do 3 surfaces on the front of the tooth and then 3 surfaces in the back of the tooth. And so you take measurements, and the good measurements, they always range from 1 to 3. That means it's good. If they get a measurement of 4, that means they have gingivitis. Their gums are swollen. There's inflammation going on. And then if there's measurements of 5 or higher, that just means that there is a chance of having periodontal disease. And when you get measurements like that, that means there is bone loss. And when you have bone loss, the bacteria, they can go down and live there and just multiply and just cause more damage to the gums and the tissues, the soft tissues of the mouth. And then, working in periodontics, I use the probe measurements to make sure that there's pocket reduction. And then I also make sure that they don't have a lot of plaque buildup because they're set on a care where they come in a certain amount of times to get their cleanings done. So I always make sure, like, are they following oral hygiene instructions with the brushing, the flossing, and the rinsing to reduce the plaque? And then also I make sure that there's bleeding reduction. There should be absolutely no bleeding. Bleeding is a sign of infection. Anytime a dental hygienist is scaling or cleaning around the tooth, there should absolutely be no bleeding, because when there's bleeding, that means there's an infection, and that's the bacteria that's causing the plaque buildup, and then the plaque buildup is causing your gum to get irritated and then bleed. And then also, I also make sure that their bone progression has not continued. So when you have periodontal disease, the jawbone, even the bone on the top of your mouth, it can actually get eaten away. It could deteriorate. So we can take x-rays from time to time, and we make sure that their bone hasn't progressed further, and they're taking care of their oral health, and they're flossing every day. And also with gingival retention, I always make sure that their gums has not receded. I always make measurements with the probe as well. You can use a probe to see, measure where their gum was before and where it should always be. So I always make note on that. So that is how I work as a hygienist in periodontics. I make sure that their gums are healthy. It's coral pink. It's stippled. I make sure that there's no swelling. I make sure that they don't have any plaque buildup. And our philosophy is having good gum care. That's part of, who we are at the office that I'm at. We really emphasize that your gums should be healthy and you should never have any type of bleeding whatsoever. And then as a hygienist working in general dentistry, this is where after, the dentist has made his diagnosis, this is where I can, recommend certain procedures, for the patient. As you can see with the animation on the bottom there, I always recommend amalgam filling replacements because what happens over time, the silver fillings, they end up shrinking. And then the bacteria from your saliva, they can actually seep through those cracks between the filling and your tooth, and they can cause cavities to form under. So we always recommend to replace those fillings and put the fillings where the composite fillings where it's clear and you can't even tell that you have fillings. And then I recommend, the next one is fillings, where obviously if someone has a cavity and you drill out, the dentist would end up drilling out the cavity and then you put the fillings there. And then we also recommend crowns, for anyone that may have that ends up having a root canal or who may end up needing a bridge. We always recommend crowns to patients so it can provide stability to the tooth because when you shave down a tooth, it becomes very vulnerable. It becomes weak. So you need something to place over the shaved down tooth. And that's where a crown comes in. So it can protect the tooth. And then you have onlays and inlays. That's another type of, filling. It's like 1/3 of a crown, where a crown is basically your whole tooth. It's a whole tooth replacement, but with the onlay or an inlay, it either replaces like the cusps of your tooth or the pits and fissures of your tooth. And then there's bridges. There's bridges where it's a tooth replacement for those that may have a missing tooth. And if an implant is too expensive for them, we always recommend bridges. And then bridges, it goes hand in hand with a crown. And then for those that want that aesthetic look, I always recommend veneers to patients. If they have a cracked tooth or a discolored tooth, I can always recommend veneers. All right. As we continue further into the typical day of my work life, I'm going to explain a little bit more on periodontics. So periodontitis is actually gum disease. And that's where your gums have a serious infection due to the bacteria that develops into plaque. Plaque is the number one cause of periodontal disease. And if it's not removed in a timely manner, it causes infection to the soft tissues of your gum. And then if the person doesn't, treat it in a timely manner, it can progress further. And that's where it attacks the gums, causing you to have gingivitis. And then if you don't treat it at the gingivitis, it progresses further into periodontal disease. And so when you allow periodontal disease to progress, that's where you end up having bone loss. So as you can see with the picture here, you start off with having healthy gums. And then if you don't, do the right thing of flossing regularly, brushing and rinsing, you end up having gingivitis. Gingivitis is a form of periodontal disease. It's the beginner stage. Basically, it's like a warning sign. It tells you, hey, you're not flossing regularly. You're not brushing properly. Please take care of my gums. That's what gingivitis is all about. It's inflammation, but it hasn't reached your bone yet. Then, if you let it progress, you have periodontitis. There's early periodontitis, there's moderate, and then there's advanced. All right. So as you can see, when it comes to the advanced stage, the gums have receded tremendously. And then you can also see that the bone has receded tremendously as well. You can just tell by how long the teeth are, but really the areas that are being exposed of the tooth, it should not be exposed. And so I placed a picture on the bottom of x-rays to show a normal bone level where everything is nice and even. But then on the right side of it, it shows when you have periodontal disease, when you allow plaque to take control, your bone ends up demineralizing, and then it goes down, exposing the root. And then when your root is exposed, it most likely may show the signs of your tooth being mobile. And then when your tooth is mobile, you have to end up extracting it. All right, so how does a hygienist like myself treat patients who have periodontal disease? So like I stated earlier, I would probe for pocket measurements. I would look for the pocket measurements that are 5 and higher. And so if you see pocket measurements that are 5 or higher and it's bleeding, and on the x-rays, you can actually see the calculus in that area, they for sure need scaling and root planing, SRP for short. And what we all know it as a deep cleaning. So as you can see in the animation there, you would go beneath the gum line and you would actually go to the root of the tooth and you would scrape off all the hard deposits, because you have to get the root of the tooth to be very smooth. Because what happens is if you don't remove all of it, the bacteria, they can thrive off of what's left behind, and they can just multiply again. And then just cause your gums to get irritated, and then cause the gingivitis and the bone to progress further. All right. So for those that end up having large pocket measurements, we end up administering antibiotics, whether it be Atrodox or Arestin. In my office, we use Atrodox, and Atrodox is basically an basically an antibacterial agent. And so I would put drops of it into the gums. And then it is a slow releasing agent. And then the slow releasing agent, it kills all the bacteria. And then once all the bacteria is gone, after a couple of days, the gums are able to reattach back to the tooth, the root of the tooth. And then when they come back after a couple of weeks, I would use my probe again, and I would see if they have any pocket reduction, which is good. So if there was someone that had 5, 6, or 7 pocket measurements, if they went from a 7 to a 5, or maybe a 6 to a 4, that is great. I am very happy. And they have to do that along with flossing after 7 days after the antibiotics is administered. Though after the 7 days, they can go back to flossing, brushing, and rinsing properly. That's where you will see the tremendous results, because the flossing, it'll prevent the bacteria to go back down into the pockets, because you can actually have healthy pockets. Healthy pockets is where I probe in that area and no bleeding has happened. And then after the cleaning and I administer antibiotics, I would instruct the patient to rinse with chlorhexidine for X amount of days. And so I say X amount of days because some dental offices are different. In my office, I say 7 days, but also depending on the patient, if they were bleeding severely after the cleaning, I would say 10 days, and they would have to rinse with it morning and night. But you could go up to 14 days, but never go past 14 days rinsing with chlorhexidine, because you end up having chlorhexidine stainings. All right. And then after they have gone home, after the deep cleaning, and after I give them all the instructions, I would bring them back in 4 weeks. The generalized scenario is always 4 to 6 weeks for a reevaluation. But at my office, we do 4 weeks. And so after 4 weeks, I bring them back in. I make sure that they have gotten better. I make sure that they have gotten on track. And then I set them on a continuing care or recall, where they come in every 3 months. Because if you wait past 3 months, the aggressive bacteria that causes periodontal disease, it grows every 3 months. So if you wait after 3 months, like if they come back after 6 months, they're going to risk having more gum recession or bone demineralization, because the bacteria, it will eat at it again. And the bacteria, it has to be removed every 3 months. They cannot wait longer than 3 months. All right, so I'm going to show you another concept in periodontics where those that have severe bone loss, like this one right here on the lower right that I showed you, they can qualify for a procedure called laser assisted new attachment procedure, LANAP for short. So how they can qualify for this is you would probe the gums and you determine which teeth and gums need the treatment. And then you use a laser that basically explodes the bad infectious causing bacteria. All right. And so this is actually done by the dentist. And the rule is when a LANAP is going to happen, a cleaning should never happen before a LANAP procedure, because the laser, it thrives off the bacteria. Because if you clean their mouth, if you do a deep cleaning, the bacteria, it's not going to be there for the laser to zap away. So we always tell our patients, probably don't, brush or floss for a couple of days before their LANAP procedure. So the next step would be, after the laser explodes the bad infection causing bacteria, that's where the hygienist can actually go in and use the ultrasonic scalers and other instruments to remove the calculus. All right. My dentist, he has called me or the other hygienist to come in and remove all the bad toxins. And even if there's like one little speck of calculus that gets left behind, it actually wouldn't be a big deal, because the laser, it actually zapped away all the bacteria that's living in that calculus. And then after the hygienist goes in and cleans out all the bad toxins, mold pockets to prevent the formation of the new tartar are formed. All right. And then you would use the laser again to connect the gum and tissue back to the root. And then you would have to seal the pockets with the fibrin clots that are formed into the blood. And then you polish the teeth to further prevent the formation of new tartar. All right. And so how I end up treating the LANAP patients when they come into my chair is that I cannot probe them for 8 months, because that is going to disturb the healing process. Okay. I cannot even use like the ultrasonic scalers or the instruments as well. I can't use anything that will cause, gum irritation. All right. Only prophylaxis can be done. I can only use the polish handpiece with the prophy paste. That is the only thing that can be used. Nothing can touch their gums. Nothing that causes trauma to the gums. Okay. And then after the LANAP patient has been seen, they have to be placed on a 3-month recall for the rest of their life, because they are at risk of gaining that aggressive bacteria again. And then I just wanted to show like the great advantages of using the LANAP, because the LANAP, it can actually grow the bone. As you can see, the first picture on the left, these are actually pictures from the internet. So you see how this picture right here, it has very aggressive bone loss. Then after the LANAP, it grows the bone 20 to 30%. And they can have stability. They won't have a lot of mobility with that tooth. And then on the right, you see another example with, tremendous bone loss, and then 6 years after going through the LANAP procedure. And this is after where they're still they're still doing their part, taking care of their gums by flossing, brushing, and rinsing, and seeing their dental hygienist regularly. All right, so I just completed discussing like my role working, in periodontics as a dental hygienist. All right, now I am going to explain the kinds of complaints that patients always present with. The main ones I hear all the time are, I have sensitivity on this side of my mouth. And when there's sensitivity, most likely there has been gum recession. And there's a picture on the bottom left that you can see. Because with gum recession, you're exposing a certain area of your tooth that shouldn't be exposed. That second layer is called the dentin. And the dentin, it is one of the most sensitive areas of the tooth. And so you can gain sensitivity by, if you're brushing too hard in that area, if you're not flossing and allowing the bacteria to eat at your gums. And also, if you do end up clenching or grinding your teeth together, you can cause trauma between your tooth and your gum line. So that is, I would, recommend certain treatments to patients that end up having sensitivity due to one of those concerns. Another complaint that a patient can come in is saying, I am feeling a strong pain on this tooth. Sometimes they can feel pain on that tooth. Maybe a cavity is forming. Maybe, they had a procedure done on that tooth, whether they had a crown or a root canal, and maybe, it has failed. That could be one of the strong pains that they're going through. And, an infamous one is, I think I have a cavity on this tooth. And they could be right. Sometimes they could, move their tongue around the tooth and they could feel like a gaping hole there. Or sometimes it necessarily doesn't even have to be a cavity. I had a patient say to me last week that they thought they had a cavity when really it was a plaque buildup on the back side of their lower front teeth. And they felt like, a chipped portion of the plaque that fell off, the calculus that fell off. And so I educated them on it. So in the end, they didn't even have a cavity. And so another complaint can be, why is my tongue green? Obviously, your tongue could be green, white, maybe even browns because you're not brushing your tongue properly. So I'll educate them on that. And sometimes I'll even use the lateral sides of my ultrasonic to remove all of the plaque, the bacteria, all the white gunky stuff off their tongue. And then another infamous complaint that I get is, my wisdom teeth are hurting me. So obviously you can see in the picture down there, your wisdom teeth could actually be impacted. Depending on, each person, your jaw and it could be very small. And sometimes, your teeth aren't necessarily going to all fit on your jaw. And so the wisdom teeth, they try and come in, they try to make space for themselves, and they're just penetrating through the tissue. And so it just causes more issues down the line. So what's always most likely recommended is extracting your wisdom teeth. Another complaint is, I am waking up with headaches and pain in my neck. What this condition is caused from is temporomandibular disorder, or TMJ. That is where, like I stated earlier, where you're grinding, you're clenching, whether you're in a stressful environment, sometimes you don't even know. And so how we can always tell if a patient is a grinder is by looking on the wear of their teeth. As you can see on the lower right, you can see how the patient's teeth are looking flat and even. And that's how they can also gain sensitivity, because there is a portion of the tooth that is being exposed that should not be exposed. I get this main complaint all the time. My cheeks are hurting, my neck, my head. Sometimes it goes down all the way to my back. And so what we would always recommend is a night guard to help solve that problem. Another one, a most common one, is, I don't like my crooked teeth. So in this case, that's where me or the dentist, we would always recommend braces, whether it be Invisalign, fast braces, or just traditional braces, because having straight teeth is a good advantage for having good oral hygiene. If you have a lot of crowdedness, you're at risk of having periodontal disease or even gingivitis, because, plaque, the bacteria, they thrive off of the crowded teeth, because it's easy to just accumulate in those areas. And sometimes it's going to be harder for you to even floss in those areas. So since you're having difficulty flossing in the crowded areas of your teeth, the plaque, they'll most likely pile up in that area. So braces is always recommended.
Miss Deidra, I'm sorry to interrupt. Just want to let you know it's 9:15, so maybe if we could get through the other slides a little quickly and we can get to some Q&A.
No problem, sure. All right, so the kind of procedures that that a hygienist could perform is we do exams. We make sure the gums look very good. We take x-rays to make sure the bone is looking excellent. You don't have bone loss. We also do oral hygiene instructions. We do tobacco cessation programs where we'll help you if you would like to quit smoking. We administer fluoride and to prevent cavities, and sealants as well. We'll also administer local anesthesia to numb the area that we're cleaning so you can have a lot of comfortability. And we have the cleanings where it's prophylaxis, gingival scaling and root planing. All right, the diagnostic test that we do is x-rays. That's where we can see cavities. That's where we can see how healthy your bones are. We also do oral cancer screenings where we use a diagnostic tool called the Bellscope, where we look into the gums, and the green light, it'll penetrate the gums to see if there's any suspicious lesions there, any dark lesions, to let us know if it's cancer or not. There's also saliva tests where you can spit into a tube, send it to a lab, and then they can also test out the bacteria to see if you're at risk for having, periodontal disease. And you can also use plaque disclosing solutions. And, once you use a plaque disclosing solution, it'll, leave an area that's purple to let you know that that's where you can work on to remove the plaque. And then there's the probe that I mentioned earlier to show, any pockets that you have. And there's also the Explorer to help us, detect calculus so we can go in and take out that calculus. All right, so here are the instruments that we use to take out any plaque that's underneath the gums. There's all different types of instruments that we use to take out, from out of your teeth, from under your gums. These are the manual instruments that you use. And then another one that we use are called the ultrasonics. We use the piezo or the magneto. You can also see the animation right there on the lower right. It uses vibrations, water, and pressure to remove, hard deposits. All right, and then another instrument that I may use to remove plaque and stains is the Air and Go powder polish. And then, for those that are old school, you can also use the polish handpiece. These remove heavy stains, and plaque that's probably left behind after you use the scalers or the ultrasonic. These are very important instruments. And then new technology in dental hygiene, it could be the smart toothbrush. I always recommend to my patients the Oral-B electric toothbrushes. Electric toothbrushes are always the way to go because they can remove plaque from every tooth surface. And then there's digital x-rays. We don't have to use, the manual x-rays anymore. With digital x-rays, they just appear right then and there, right in front of your eyes. You don't have to develop them. And then there's also the intraoral camera, where you can, educate the patient. You can take pictures in certain areas of their mouth. And then once you display to the patient in front of them, it can give them that actual physical, idea of what's going on in their mouth so they can help get back on track to having good, proper care. And then a new thing that's out there is teeth whitening with LED lighting, with light. So technology is advancing in dental hygiene, and there's probably more technology that's going to come on out there, and I am very grateful that I'm able to use the electric toothbrush, the digital x-ray, and the intraoral camera. I haven't gotten to the LED light for teeth whitening, but I might get there someday eventually. All right, and the important terms in dental hygiene that that are very important are prophylaxis, gingival scaling and root planing, periodontal maintenance, atrodox, and gingival irrigation. So with prophylaxis, right next to it are the dental codes. That's where your scaling and polishing procedure is performed to remove coronal plaque, calculus, and stains. And this is done on those that have healthy teeth and healthy gums. And then the gingival scaling is where you're scaling in the presence of generalized moderate or severe gingival inflammation. And it can either be full mouth after oral evaluation. So gingival scaling is where you're cleaning someone's mouth who has gingivitis or inflamed gums. And then scaling and root planing. This procedure involves instrumentation of the crown and root surfaces where you remove all the plaque, all the hard products off the root of the tooth. And it is indicated for patients with periodontal disease, and it is therapeutic, not prophylactic. And then periodontal maintenance is very important because this is done on patients that have periodontal disease and have already gone through the deep cleaning. And then anytime you bring them back on a specific recall, it is considered periodontal maintenance because you're maintaining their bones and their gum and making sure that the bacteria has not reproduced again. And then for gingival irrigation, this is also called oral irrigation. That is where once you're cleaning underneath the gums, you're using water. And in my office, we add a rinse called chlorhexidine into the water to reduce the inflammation all at the same time. And it removes the built up plaque and the debris all from under the gum line. And then atrodox, the last word that's very important. The code, it stands for localized delivery of antimicrobial agents. And, it's released in the clavicular tissue and it's all throughout the tooth. And then the atrodox itself, it is the product and it's released under the gums to help fight off the bacterial infections. All right, so here's case number 1. This is where I have cleaned off the plaque buildup on a patient that had implants done. So here is a before and an after. It's very therapeutic for me to knock the plaque wall down. Here's another example for someone who came in for a gingival scaling. As you can see on the left side, this is all the plaque accumulation, all the calculus accumulation. And on the right side, this is the after product, the result. And he's actually coming back next week for the 4-week re-eval. And then this is, sorry for those, I didn't warn you for the blood, but this is for someone who actually went through the deep cleaning. And I took pictures to show him like the areas that he needs to work on. And this is what happens when you allow, plaque to go underneath your gum line. So I took pictures to show him where he needs to work on. And he's also coming back in soon for a 4-week re-eval. This is what happens when you clean someone who doesn't have healthy gums. And the last case, as you can see, this is someone, I wanted to show x-rays. This is someone where they have cavities. As you can see on the upper left, you can see the holes right there, the little black, dark shaded region there. And then on the last 3 photos to the right, you can see how you see the calculus underneath the gums and they look like wings. But all that is heavy calculus deposit. All right, so advice to our future dental hygienists. I say take it one day at a time and keep shining like the bright smile you have. And like I always say, never give up.
Awesome. Thank you so much, Dr. Deidra. Miss Deidra. That was a really great presentation, and sorry for making you rush towards the end, but really appreciate you putting all the details. And Kathleen is going to take a few questions from our chat now.
Yes, thank you, Ms. Russell. Our first question is, let's see, around what time does your day usually end?
At my dental office, it's very flexible. It really depends. Like there are days where I can finish at 5. There was a day that I clocked out at 8 p.m. It really all depends on the day. Sometimes I'll see my first patient. Sometimes it'll be a 12-hour shift, or sometimes it'll be a 9 to 5 shift. Like just a couple of weeks ago, I saw my first patient at 7 and I didn't clock out until 7 p.m. So it really depends. But on average, it's a typical 9 to 5.
Were the national board exams all timed? Like about how many questions?
They were all timed. For the laws exam, I'm really trying to remember. I believe that the laws exam for Florida, it was about 60 something questions. For the national board exams, I believe, if I can remember, it's 300 or if not, maybe 350. But I want to say 300. It's 300 questions. And now there's a new version out because due to the pandemic, there was 150 questions created. And then for like the computer stimulated, I got 80 questions on that one, but they are all timed.
What's your favorite favorite or go-to instrument?
It is the S204 and the Nevi. I love those. Those are my favorite. I love working on the anteriors. And then when I start to get to the back teeth, the molars, I just love using the S204. That is my favorite one all time. At any place I go to, I always have to make sure the S204 is there and the Nevi. I love it. Those are my go-to.
How competitive is MDC?
MDC is very, very competitive because there's 49 chairs, but sometimes they'll accept 50 people and thousands of applicants apply. Like, it is very competitive. That's why I always recommend for anyone applying to MDC, always go for a 4 like aim for a 4.0 GPA and try and get all A's. And if you're not able to get all A's, maybe like 1 or 2 B's is okay. But try and aim to the top because there are people that are going to get the all A's and they accept you based on ranking.
When you were looking to work, what were you looking for in an office?
I was looking for flexibility, and I was looking for where, just like what I had now, where we had a philosophy to believe in. I really wanted an office that really emphasized on having good gum care. You know, I was really looking for a periodontal office. And I was also looking for where you're a family with your coworkers. And that's what I have. If you're great with your coworkers and you have a great relationship with your dentist, that's where your passion will end up thriving and growing. And you'll have a reason to look forward to work too.
Do you have to take any exams whenever new technology comes out?
No, you do not have to. Like, so if anything, you would just have to be trained, you know, in the dental office that you're at. Like, if the dentist decides to order that new technology device, you would just be trained on it. No exams. The last exams are the board exams. That's it.
Do dental hygienists have a more flexible schedule than dentists? Or is it
They really do. They really do have a flexible schedule because, you know, with the dentist, they have to be there every single day. You know, there are some hygienists where they can decide to work 2 days a week, 3 days, 5, even 4. It really all depends. And, you know, there are some hygienists that, you know, work with, you know, temp agents where, you know, they could place them in dental offices and they can actually move around from office to office. That's how flexible it is. And they can build up their own schedule. And that's where you end up, you know, job searching. You look for the dental office that best fits you.
Do you think you would ever consider continuing your education to become a dentist, or are you set on being a dental hygienist?
I am set on being a dental hygienist. I really love this career. I'm so happy in it. I really have passion for it, but I do plan on continuing my academic education.
Did you shadow before the program?
I did. I shadowed once before the program, and that's where I was able to, you know, to have the spark of becoming a dental hygienist. I shadowed 3 dental hygienists actually, and that's where I was able to confirm my love for it.
As a dental hygienist, are you able to move like around the country or the state, or are you like fixated on in one place?
Like me personally, or like in general?
In general, like.
Yes, of course. Like in dental hygiene, if you would like to move, you could move. But I do know that if you move to that state, you do have to take their state law exam. But I know there are some states where you don't necessarily have to take their laws exam. And it's just that one exam. Like if you move to a state, you don't have to take the nationals over again. You don't have to take the mannequin or like the patient clinical exam. It's just the laws exam if you end up moving to a different state. You can move wherever you want to. And there's also a travel program that's stationed in Virginia where you can move to different states.
Very, very interesting. Thank you so much, Ms. Russell. We really learned a lot about the dental hygienist route since we get a lot of dentists. This was like something different, yet very similar. Thank you so much.
We're very similar in some sort. The only thing we can do is surgeries. That's about it.
True.
But yes.
Very true.
Yes, thank you again, I keep saying doctor because we have so many dentists.
I know.
Thank
It's
you
okay.
again, Miss Deidra. It was a
Yes,
really
thank you.
informative presentation, as Kathleen said, and thank you everyone for joining us today. We will count this session as 1.5 virtual shadowing hours since we did go a little over. And be sure to follow Miss Deidre's Instagram and be sure to join the other sessions we have this week. And we hope everyone has a great rest of their night. Bye, everyone.
Yes, thank you. Bye.